Hi, my name is Lillian Schmitz. The date is May 29th of 2021. On the back of my note card here, I just have notes to follow along with for my presentation. So today I'm presenting on superficial anatomy of the body and external structures that we can see just by looking at the body. So the first structure we're going to go over is the calcaneus. So the calcaneus is part of the skeletal system. It is the heel bone, so it's right here. It is the largest of the tarsal bones, and it protrudes posteriorly, and it takes the weight of the body as the heel hits the ground while walking. So the next superficial anatomy we're going to go over is going to be the popliteal fossa. So the popliteal fossa is right here. It's part of the muscular system. So it is a diamond-shaped depression that is on the posterior aspect of the knee. Four borders form this diamond. So we have the semimembranous, we have the biceps femoris, and then we have the lateral head of the gastrocnemius, as well as the lateral head of the gastrocnemius over here, and then the medial head of the gastrocnemius, as well as the plantaris right here. So that is going to be your popliteal fossa. Next, we have the tendon of the flexor carpi radialis. So the tendon of the flexor carpi radialis is going to be in an anatomical position. It's going to be the more lateral tendon right here. So this tendon, this muscle is part of a muscle, and it originates at the medial epicondyle of the humerus and attaches to the base of the metacarpals 2 and 3. So this muscle flexes, and it also abducts the wrist. Next, we're going to go over the thyroid cartilage. So the thyroid cartilage is right here. As you can see on a male, adult males, it is a prominence, the laryngeal prominence. It's also known as the Adam's apple. So the thyroid cartilage is part of the skeletal, respiratory, and associated with the endocrine system. So again, it's part of the laryngeal cartilages. It protects the thyroid gland, and it is shield-shaped. It's easily visible in adult males, like I'd said. And the thyroid gland is an endocrine gland. It secretes hormones in order to regulate the body. And this thyroid cartilage protects the thyroid gland. Our final superficial anatomy, our final external structure, is going to be the head of the ulna. So the head of the ulna is part of the skeletal system. So it is going to be, nope, we're going to turn this way. It's going to be on your medial wrist. So if you look right here, there's a prominence that sticks out, and this is going to be the head of the ulna. So this is going to be on your pinky side, so your medial wrist. It articulates with the radius at the radio-ulnar joint, and the flexor carpi radialis is also in charge of supination and pronation. So that radio-ulnar joint allows you to do that. Now, finally, we're going to use clinical applications towards these superficial features. So the first one we're going to go back to is the popliteal fossa. So that, again, is that posterior aspect of the knee, that diamond depression. So swelling in the popliteal fossa is what we're going to discuss here. But so the popliteal fossa serves as the main channel for nerves and blood vessels entering and leaving the leg. So the first cause of swelling in this area could be a Baker's cyst. This is inflammation of the semimembranous bursa of the knee joint, and it typically is related to osteoarthritis. So another cause could be a popliteal aneurysm. So this can cause tibial nerve compression and result in weakened or absent plantar flexion. So that would be flexion of the plantar, or your sole of your foot. So, and that would be absent if this was present. And then it can also be detected by popliteal pulsation. So that would be taking the pulse in the popliteal artery. Other less common causes include deep vein thrombosis, as well as arterial cysts and neoplasms. Another example of a clinical application of one of our structures is going to be back to the wrist here. that tendon of the flexor carpi radialis. So just lateral to that, if you place 2 fingers here, you can take the pulse if you're in the right position, the radial pulse. And that will allow you to feel the pulsation of the heartbeat. So that's a lot of times how you take a pulse in clinical settings. Surface anatomy is useful for using landmarks of the superficial body to locate skeletal, muscular, and vascular structures, as well as locating deeper structures using these landmarks. It also allows medical professionals to assess a patient without using technology. Thanks so much for listening. Have a good